I'm Dr. Rick Buck, and I've been a dentist for 17 years. In this video, I will show you how I do composite veneers without shaving down teeth in this case. I will also explain along the way why I like composite veneers better than cosmetic crowns and normal porcelain veneers, why I think they are the best option, and lots of things to know about them. Our patient today doesn't have bad teeth at all, in my opinion, but she has a small gap between her front teeth that she doesn't like, and some discoloration on her other front teeth that she just really doesn't like. And so we're going to cosmetically fix all of this. And so when she comes in for that consultation to start, I take some pictures and show her this little diagram over her teeth that gives her an idea of what her teeth could be. And it also lets me know if an aesthetic outcome is achievable with composite veneers. Now, most patients get excited even with just this. And this consultation can be done online from anywhere really in the world. But once the patient consents to treatment during this consultation, there are 3 appointments. The first appointment, we take measurements of the teeth and gums and pictures of the teeth and face. After those pictures and records are taken, we move on to balancing the bite. As you may have noticed, our patient's teeth are a little flat and worn down. This is due to the excessive grinding the patient has done throughout her life. And if I do any sort of restoration to her smile in this state, she will just break and grind through her composite veneers as she did her natural teeth. So to combat the grinding and teeth wear, I make small adjustments all across all of her teeth so her teeth better interlock as she bites down. So for a lot of people, especially people that grind their teeth down, when they bite and then slide into place and then their teeth interlock. But when teeth interlock without sliding into place, it's difficult to grind, especially through veneers or teeth. Now that I've done this, their bite feels much more natural. After balancing the bite, we take a scan of the teeth, including how they bite together in their new position. After we scan the teeth in the new bite position, we are done with appointment 1. But before the next appointment, there's a lot of work and planning to do. With the pictures, measurements, and scans, we design the new smile. First, we need to see if we want or need to do any drilling on the teeth. Most of the time, that's so the teeth don't look too big in the end, because you want them to look a nice cosmetic natural size. So with our current patient, her natural teeth are smaller than the ultimate cosmetic proportions of teeth that you would want with her shape and size of face. So in this case, we can actually add a lot to the size of her teeth and they are still going to look natural and beautiful. So especially in this case, I do not have to file anything now. So once I've kind of planned and decided all of that, I have a lab technician who makes a mock-up or 3-dimensional design of the smile we are going to build. So he takes all those changes and my desired dimensions and he puts them in a 3D smile designing software. And then he 3D prints the design for me on a model. Now, some of those changes that I've asked him to make are to add size to the teeth based on our measurements. So for example, here we want to increase the teeth size. So we will lengthen the edges of the teeth just a little bit. But more importantly, we're also going to trim back the gums to add length at the gum line, not just the biting edges of the teeth. People rarely realize how much the gums dictate the cosmetics of the teeth and smile. In fact, sometimes I'll trim back the gums on patients in what we call a gum lift, and the patients no longer even want all the other treatment that I have planned out for them. Now, if you want more on that, I have a gum lift video about all of that. Now, in addition to increasing the length of the teeth, we increase the size of the teeth in thickness from front to back as well. If you thicken the composite veneers with composite, they will rarely chip or break. In fact, with this procedure, this is why we do all the front teeth together. For example, if you only did one tooth, you need to either make it thin enough so it blends in, but it would likely chip, or make it so thick that it doesn't break, but it would stick out because it's not blending in with the other teeth. So obviously you don't want one of those. But another thing you can do is you can file back the tooth and then add thickness of composite to go back to where it was before. And that way it won't break and it fits in. But ultimately in these cosmetic cases, we do multiple teeth so that they are all thick and we can all get them to blend in one to another. And that way, since they're all thicker and blend in they won't break as well. And so the last two things we take into consideration when designing the smile is that we make sure that the arch looks nice when we're looking down on all the teeth. And also we make sure that the smile line of the teeth fits her lips and her face when she smiles. Once we have the printed model to my specifications, we make a little putty matrix. And this putty is like soft putty that hardens over time. And this is going to help me know where the edges of the teeth will go during the next appointment. So now on to appointment 2. The first thing we do after numbing the patient is we trim back the patient's gums. My style is to make the zenith of the gum level about the same height on all the front upper anterior teeth. So those front teeth, the apex or the zenith of those gum levels is going to be all kind of in line one with another. Some people make the lateral incisor gum level just a little bit lower than the canines and central incisors. But once again, my style is to have them all about the same level. With the gums in line, we can now start on the teeth themselves. Now to start, we do one tooth at a time, and we begin with the upper right central incisor. The reason why we do it this way is we start with one, and once we get that one right, then it's easier to get the second tooth exactly right. And then once we have those two teeth exactly right, the rest is pretty much easy and fits all together and goes smooth. So now we just take our drill and we lightly kind of brush off this invisible plaque layer by running the drill over the surface of the teeth. And we're not drilling the tooth, we're just drilling off this light thin plaque layer that you can't see. Now, we do actually do a little bit more drilling in this case. We remove an old filling that the patient has here too. And this is the most we're going to use the drill on the actual teeth. For this patient, it's not a lot. As you can see, the patient still kind of has like that same tooth shape. We didn't really do any drilling except for the filling. Now for some people, we will have to drill a little bit to meet their goals, but this patient, definitely not. Now with that invisible plaque layer kind of brushed off, then we use this sandblaster to micro etch the teeth. Now you can't see this very well because the sand is so fine, but it's shooting little granules at the tooth at very high rates, and this etches the surface of the tooth. The reason we do this is it increases the bond strength of the composite veneers significantly. So your composite veneers are going to be so tightly bonded to these teeth that they are rarely going to have any issues. The technique of this sandblaster is to aim it away from the gums as you're doing it and to kind of shield the gums so they aren't damaged by the sandblaster. And just a quick note, these fine grains of sand can get everywhere, but it's not that big of a deal because we're just gonna rinse them all out like we do everything in dentistry. So now let's move on and let's put in a thin layer of Teflon over the adjacent teeth to protect them, and mostly so they don't get anything bonded onto them that we can't see. And so with the Teflon on, now we're ready to use the acid etch over the surface of the tooth. And this is the acid etch that we use almost every time we bond in dentistry. And then we just rinse all of that etch away. Now I apply a very, very strong bond to the tooth and really try to scrub that bond onto the tooth because that gets a very strong hold or very strong bond of the composite veneers when you scrub it into place. And with that scrubbed into place, then we light cure or set the bond to the tooth. Okay, now we grab the putty matrix that we made before the appointment and we put enough of the resin composite to fill in the new edge of the tooth. And all we're doing right here is making the edge of the teeth. And we just kind of pat that composite into place in the matrix. And then with that matrix, we put it over the tooth and use a light to set that composite onto the tooth and set it into place. Now this kind of looks ridiculous. The rest is just kind of easy to do once we know we have the predetermined incisal edge. The reason this all works is because the edge of the teeth registers the proper arch form of the tooth, the length of the tooth, and the thickness of the tooth. And that just easily lays the cosmetic foundation for the rest of the tooth. This is why you want to pre-plan that edge of the tooth. Otherwise, you're kind of just guessing where you want that edge to go, and that can take a lot of time until you get it right. So that is why I use this matrix, just to get that edge perfect. Now, after I've removed it, disregard that extra piece. We will remove that later. But now we're going to build up the midline of the tooth and give it the proper contour with this metal matrix. matrix. We use this preformed matrix because we're gonna use it here and on the tooth next to it so that the contours can match each other perfectly. So here you see we're etching and bonding again that midline surface. And with that matrix still into place, we flow a composite into the midline and we set that with a light. And so like I said, that contour needs to be perfect and match the other tooth. And it looks like I've gotten the contour just right. Now with most of the important parts of the shape done, we're going to move on to the rest of the contour and filling the bulk surface of the tooth. To do this, we maneuver this clear strip into place. The placement of this clear strip is important because it will get a smooth and flawless transition from the natural tooth to the resin composite. And this transition between the tooth and composite is called the margin. And if poorly done, it's where decay and a plaque trap or a cosmetic flaw can form on any restoration actually, whether it's a traditional crown, porcelain veneer, or these composite veneers. So this margin is very important. And once again, this clear strip placed correctly will almost eliminate any of these issues and is a major reason why I love to do this method. The transition here is just flawless and so smooth when done correctly. Now, once again, I'm going to etch and bond. And then after, I'm going to fill this up with a flowable composite and then at the same time, a packable composite. You can't see it that well on this tooth because I had to turn off the light because the material was setting too quick when the light was on. As I turn my light back on, you can see this looks really funny at first. It doesn't look like a tooth at all. But the important part is that the base and margin all have the appropriate cosmetic and functional dimensions. And you will see that after we file the front side of the tooth down, which I'm going to do right now. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Now, after we file that front side down, which I didn't capture very well on camera here, we get a very smooth and beautiful outline of the shape of the tooth. In fact, I even draw the outline of the tooth with a pencil and smooth up the edges with discs to make sure that outline is perfect. Now with that outline and the edges are going to make the perfect frame for the cosmetics of a beautiful tooth and ultimately a beautiful smile. Now, once we get the first tooth outline right, we now have to match the second central incisor to the finished first central incisor that we made. So here you will see me doing all the same steps so that both central incisors match perfectly. Because once again, once those two front central incisors match perfectly and are beautiful and in the correct cosmetic position, the rest is easy. It just does itself. It's hard to explain. While you're watching this, just let me tell you why I love composite veneers and why they turn out so good. First, when you do composite veneers, the patient is right there in front of you. So if there's something you both don't like, you can change it and fix it right there. With crowns and conventional veneers, if you don't like something, you have to send it back to the lab, and that takes a little while, and maybe the lab understands what you want and resolves it, and maybe they don't. But with composite veneers, you change it right then and there with the patient's input, so you know you're gonna like it, and you don't have to worry about how long it will take to get any changes in the cosmetics. Second, you form these with the patient right there, so you take everything there into consideration, like the face structure and the smile line, and you can take that all into consideration while you are making the veneers right there in front of you. Third, if anything ever happens to these, like chipping or breaking, then you can just fix them or add to them all right in a simple, easy appointment. In contrast, if a crown or a porcelain veneer breaks, you need to make a whole new one. And I say one, but it's very difficult to get one to match the rest perfectly when you're doing it not together. So you may have to redo all the teeth if one thing happens to one tooth. But with composite veneers, you can likely just fix it all right there and don't have to do any of that. You can just fix just the part that's chipped or broken. You don't have to even fix the whole tooth, let alone all the teeth. Fourth, if you get a little gum recession with traditional veneers, as a lot of people naturally do, you have the same problem as I mentioned before. To fix it, you have to redo at least one and maybe all the veneers to get them to match correctly. With composite veneers, you can just add composite wherever there is gum recession, so you don't have to replace anything. Fifth, as I mentioned earlier, the margin is the weak point for crowns, veneers, and even these composite veneers. But with my process, it is much better and smoother with the technique that I do, so you rarely get any problems happening at the margins like tooth decay. Sixth, the dentist is in control of all the cosmetics. The dentist doesn't rely on a lab technician and to communicate everything correctly to the lab technician who's in another building somewhere far away. Even though I love my lab technician and he's awesome and you should use him if you're a dentist, but I like having most of the control in my hands, and so composite veneers, that's the case. And so the artistry, unlike crowns and veneers, is all up to me. And don't get me wrong, sometimes you have to do lab created crowns or veneers for cosmetic cases. I do them all the time actually, and they turn out great, but I love these more for cosmetic work because I get to do all of the cosmetic work. Now, if you're wondering about the pencil lines that you see on the teeth, these are there to make sure all the contours of the different teeth are symmetrical. One of the things you want to take into consideration when you're choosing a dentist for composite veneers is, are they using great materials? And by the way, I do virtual consults anywhere in the United States if you want to travel to Southern California to have these done. The materials that I use are top of the line, and I'm going to explain why I use them. First of all, these composites have a great final polish to them, so that's always nice. Second, this composite holds the color very well over years, whereas cheaper composites can stain and change color in time. Third, this material is very strong and they resist breaking and chipping. Fourth, I use the strongest bond on the market. I've tried multiple bonds and tested out their bond strengths, and this one is the strongest. So you are not likely at all to have these chip or come off completely. Okay, so now we have arrived at the end of the second appointment, which is the longest appointment, might I add. You can see already these are huge improvements cosmetically over the previous teeth. Many people actually want me to stop right here and want no changes after this appointment. To me, these look like traditional veneers, and some people love that. But if you love the more natural look like I do, at the last appointment, we're going to make these teeth look more natural, which once again is my cup of tea. But before we finalize and make sure that this is the exact shape that the patient wants, before we all add all the natural effects, we want the patient to take these for a test drive almost to see how they feel when eating and speaking and all the such. And then we will do all the finishing touches. And so now the patient comes back in for the third appointment, but you can see how good the gums have turned out now. The gums just know where to go when you use the technique that I use. But let's start today by drawing an outline on all the teeth. And by the way, most of the time the patient isn't numb for this appointment. So with that outline in place, we're going to drill away just inside of the lines. I know I just finished that second appointment with putting this all in, but now we're gonna drill everything inside of that frame away. The reason that we're doing this is the first appointment was done to just get the shape, the natural shape of the tooth. So by keeping the drawn lines, we are keeping the shape of everything. But we drill a lot of the middle area out on all of these veneers, and you will see why in just a second. Okay, so with all that area drilled away, we're now going to sandblast the surface that we drilled away again, so that we get a very strong bond once again. And then also we're going to chemically etch the surface of all the teeth and then bond them. Now, natural teeth have a lot of different shades to them. So this is what we're going to replicate with composite tints at this appointment to make them look natural. We start with a gray tint just along the biting edge of the tooth. And then we kind of streak it and dampen it so it blends in. And this may look like nothing right now, but just wait until later. Next, we move on to blue shades in the corners of the biting edges of the teeth. And once again, we dampen that so it really blends in. The gray and blue give a subtle transparent effect that most natural teeth exhibit. Next, we move on to ochre just under the gray and kind of make little swipes of the ochre color up. This color will add warmth to the tooth, and the streaks up will also break up that consistent gray shade that we put on at the base. Now we move on to a pink tint. We don't want too much warmth, so we place a little bit of pink, which is closer to off-white in color. And we do that over the ochre that we made, and we just make more streaks up to break more up of that gray that we put in earlier. If you look closely at natural teeth, they have a lot of these subtle white streaks, and so that's what we're replicating so that it gives it a very natural look. Then finally, we add what we call a halo with white or pink around the top edges of the trough that we cut earlier. Even with that gray earlier that we put in, natural teeth will get this subtle white halo frame to the edges of the tooth. And so that halo is very cosmetic, and we are recreating it now. With all these subtle tints that we've added, we're going to add a filter layer on top of them. And I had to turn off my light once again for this because my light sets all of these up too fast. But this layer that we're adding will disperse all those shades that we put underneath them and kind of blend them all together nicely. This filter layer is so important in dispersing and diffusing all those effects that we put in. I can't stress that enough. And we're also kind of putting depressions in this layer to add to that kind of streak effect that I was showing you earlier. So we just kind of pull back some of the edges of that filter layer. We don't make any of this consistent. We want small interspersed color change effects for it to look as natural as possible. And what is funny is you can't tell any of this right now, but you will soon, because we're going to apply our last layer, which will be this very transparent layer that we put on top of these other layers to mimic natural enamel, which enamel itself is kind of white and kind of transparent. And what this will do is give the tooth an optical natural shine and light transmittance that is similar to enamel. Once again, you can't really tell any of this right now because we're just kind of pancaking it in there and it looks cloudy. However, we have excess material to trim back. So now we're gonna start trimming it back, and we're gonna kind of smooth the transition between this new layer and the frame that we had originally. And we're just cutting back the material and smoothing it and polishing it into place. Now, as we're drilling all of that back, at one moment, I stopped to spray the excess dust from all of it away with water, and then you can see the natural color effects start to reveal themselves. So now I just keep smoothing and keep polishing everything and kind of keep rinsing it. And you can just see how these teeth are now cosmetic, but also at the same time natural looking. And once again, I love natural effects, but I do realize this is not for everyone. Some people like that really white, monochromatic white look to them. What's funny is if you like that unnatural look, it's much easier for me, and I could certainly do that. But this look is what I love. It takes much more skill to do, and I think it looks beautiful. So people that don't know you have composite veneers won't even think twice about it because they're gonna look so natural. But before we get to the final polish, I put small depressions on the front side of the teeth. A lot of teeth naturally have these little depressions or concavities. I add them because they break up the smoothness and the light reflection to make them look more natural. Because once again, that is how natural teeth behave with light and with smoothness. Now we just keep polishing and polishing it until they get a nice shimmer, and eventually we are left with this final result. This is just so natural looking and actually give the impression that they were just born with naturally beautiful teeth. The slight color dispersion of whites, ochre, blue, and gray gives them a natural effect. The patient is happy, confident, they can confidently chew on these. There's nothing really to worry about, and they have a beautiful smile. But I also want to show you the results if we just kept them the more monochromatic style without too much natural features in them. And so you can compare and determine which style it is that you like. This patient was really nice. They let me change out the results just to show you the difference. My preference is the natural look, but both are beautiful to me. If you want something like this, once again, I do virtual consults, so feel free to go to the description of this video or my website to learn how to set up a consult if you would like to travel to California to have this done. Once again, you need an artistic and competent dentist that uses all the best materials so you don't get issues with these. And so if you're looking into these, I can make you a set that will look so good. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.